Assalamualaikum warahmatullahi wabarakatuh, and a very good morning to the fellow panels and all the people that will be watching this video. My name is MUHAMAD NABIL bin Osman, and today I'll be presenting my critical research review entitled Management and Treatment of Dental Peri-Implantitis through the Antimicrobial Properties of Propolis. Background of the study. As you guys can see on the right part of the slide, you can see figure 1 showing raw propolis at the beehive produced by stingers bee like Heterotrigona itama. Stinging bees like Apis mellifera also produces propolis. Propolis is a resin that has gained attention for its broad-spectrum antimicrobial effects. Our study explores how propolis could be applied as an adjunctive therapy in managing dental peri-implantitis, which is an inflammation around implant often caused by biofilm-forming bacteria. There are currently 3 main issues that we found in the study. First, dental implants are very expensive to replace. Failure due to peri-implantitis increases the treatment cost. Second, current treatment often fail to remove oral biofilm and also fail to resolve inflammations. Third, there is a limited standardized research on propolis in this context, particularly regarding its mechanism of actions. All of this creates an opportunity for us to explore a natural alternative like propolis. This study offers 4 significant contributions. First of them is highlights propolis as a natural alternative to current chemical-based therapies. It also suggests a way to potentially reduce implant failure, improving treatment longevity, and it opens the door to more cost-effective and minimally invasive solutions, therefore easing the burden on both the patient and the healthcare system. Therefore, my study focused on answering 4 main questions. First of them is, which microbiota are dominant in dental peri-implantitis? Second, how does KEP, one of the active compounds in propolis, down-regulate biofilm-associated genes? Third, what specific methods reinforce propolis for anti-biofilm and coating utilities? And finally, what mechanism underlie the regenerative effect of propolis on fibroblasts and osteoblasts? The main objectives of this review was to evaluate the antimicrobial, anti-inflammatory, and regenerative potential of propolis in managing dental peri-implantitis. This includes identifying mechanisms that can support future treatment and broaden scientific understanding of its properties. Moving on to the literature review. First of all, what is dental implant? As you guys can see in figure 4, showing various implant designs. A dental implant is a screw-like device used to replace the root of a missing tooth. So, why do we need dental implant? Its purpose is to restore function, prevent bone loss, improve confidence, long-term durability, and to avoid damage to adjacent teeth. While implants are a common solution for tooth loss, complications like dental peri-implantitis pose a significant challenge to the patient and also to the health industry. Next is dental peri-implantitis. It is a chronic inflammatory condition affecting the tissue around the implants. Here you can see in figure 6 showing peri-implantitis at the bone levels. And just about it, figure 5 illustrates the pathogenesis of the conditions, where biofilm releases virulence factor. These virulence factors activate immune cells, resulting in bone resorption and tissue breakdown. And you guys can also see in table 1, there are some of the common oral microbiota related to dental peri-implantitis, including Porphyromonas gingivalis, Fusobacterium, Prevetola intimedia, Argicutibacter actinomyces intermittens, and Staphylococcus. So, what is the current treatment of dental peri-implantitis? This includes conservative, drug, and laser therapy. As you guys can see in the visual below, figure 8 shows an air polishing device with glycine powder, while figure 9 shows the example of carbon carets, whereas figure 11 shows the usage of yak laser. But all of this don't fully eliminate the biofilms, and over time, bacteria will develop antimicrobial resistance (AMR). Moreover, rough titanium surfaces unintentionally favor bacterial adhesions, thus limiting treatment success. Propolis is often referred to as bee glue. It is made by bees using plant resin, wax, and their own enzymes. Its role in hive is to protect against microbial invasion and also to seal gaps. It has long been known for its antimicrobial, anti-inflammatory, and antioxidant properties. Here, figure 12 and 13 shows Apis mellifera and Heterotrigona itama, bees known for producing propolis. Its composition varies based on species and geography, but commonly include flavonoids, phenolic acids, and acetinols. These are some examples of different types of propolis produced by different species of bees: Tetragona apicalis, Heterotrigona itama, and Geniotrigona thoracea. Propolis as a treatment modality. This slide will show 6 mechanisms of propolis. First, propolis will inhibit oral biofilm formation, thus disrupt the oral microbiota. Second, it will inhibit pro-inflammatory cytokines such as TNF-alpha and IL-6. Third, it will destabilize bacterial membranes, thus increasing the permeability. Fourth, it will interfere with microbial pathway. Fifth, prevent EPS synthesis by down-regulating GTFB. Sixth, promotes osteoblast and fibroblast activity by activating genes like RUNX2 and COL1. These mechanisms are supported by in vitro studies from Zulkifli et al. Next is the analysis of research question. The first question, which microorganism predominates dental peri-implantitis? Here is figure 17, the structure of P. gingivalis, the most virulent microbe found in dental peri-implantitis. Why? Because it releases gingipains, which is a protein-degrading enzymes. It also triggers inflammation through LPS and aggregates with other pathogens, thus strengthening the biofilms. According to the studies by Alves and Klickman, these are the mechanisms that makes P. gingivalis a keystone pathogen compared to the other pathogens that I mentioned before, because some of them are just opportunistic pathogen or secondary colonization. Some of the evaluation methods for peri-implantitis pathogens are 16S rRNA sequencing for microbial profiling, real-time qPCR for specific species gene sequence quantitations, immunohistochemistry to detect pathogen presence in peri-implant. The second question is, how does CAPE mechanism within the Propolis down-regulates biofilm-associated genes? CAPE is also known as caffeic acid phenylalkyl ester. Its molecular mechanism is, first, CAPE will down-regulate FYP2 by suppressing the film barrier synthesis, thus reducing the microbial additions. Second, it will inhibit GTFB, blocking EPS production and, therefore, reduce the biofilm maturations. Third, it will suppress SPAP, which is a gene encoding for surface protein, therefore preventing coagulation with other pathogens. 6 techniques were used to reinforce Propolis for anti-biofilm and surface coating utility. For anti-biofilm utility, the first one is crystal violet assay. It was to measure the biomass formation that inhibited by Propolis up to 70% in treated culture. The second one is atomic force microscopy. It is for measuring surface roughness, where Propolis coated titanium reduced surface roughness and bacterial adhesion and attachment. The third one is CLSM. Visualize live and dead biofilm post-Propolis treatment. The fourth one is qPCR. It is to quantities gene expression like GTFB and FYP2 before and after Propolis treatment. And for the coating technologies, the fifth is hydrogels. Propolis added to thermoresponsive hydrogels enable lasting and localized delivery of antimicrobial effects. The sixth one is titanium surface coating. Propolis fill nanostructures, example like chitosan-based or silica nanoparticle matrices, enhance the implant compatibility and reduce microbial colonizations. This allows Propolis to function not just as a compound but as a coating agent. Lastly, the final question focuses on healing. As you guys can see on the slide, there are left and right pathway. On the left, anti-inflammatory pathway. CAPE and creatine suppresses an FKB by inhibiting IKB kinase, thus lowering the production of TNF-alpha and IL-6. On the right, regenerative pathway. Camphor will boost fibroblast growth via TGF, beta-1 SMAD signaling, and also boost mineralized nodule formation via ERK, MAPK, and BM2 pathway. Epigenesis stimulates osteoblastic activity via WNT beta-catenin, raising the markers such as RANX2 and COL1. The combined effect of this is better tissue regeneration and healing around the implant site. We can summarize our finding in a few points. First, CAPE and flavonoids lies in exiting antimicrobial, anti-biofilm, anti-inflammatory, and regenerative action of Propolis. Second, Propolis is very effective against primary peri-implantitis pathogens, including P. gingivalis, and can regulate major biofilm-associated genes like FYP2, GTFB, and SPAP. Third, Propolis also enhances the activity of osteoblasts and fibroblasts through some molecular mechanisms like NFKB suppression, WNT beta-catenin activations. Fourth, emergence of analysis tool and coating methods including hydrogel formulations and nanoparticle-infused surface modification. The last one is Propolis as a cost-effective, biocompatible adjunctive treatment and a nature-derived and multi-target approach to improve patient outcomes and implant survival. Despite all the promises in this research, several gaps remains. First, lack of standardized Propolis extract. Second, few long-term or human clinical trials. Third, limited insight into the molecular interactions. Fourth, unknown synergy with standard therapies. This area need to be addressed for safe and consistent clinical adoption of Propolis in the future. Thank you very much for your attention, and I also would like to express my gratitude to my supervisor, Dr. Ikmal Hisham, for his guidance. Now I am open to any question from the panel.